Mental health is a topic that affects our community, but we don't often know where to begin the conversation. And if you're a parent of a teenager, knowing how to talk about touchy issues can be hard too. Where do you start? How are United Way agencies helping us? We'll discuss that and more today. Hello and welcome to Living United, a show about how our community can be the change for those most in need. I'm Ann McNeil, United Way volunteer and manager of corporate citizenship and corporate affairs for IBM. Today I'm joined by representatives of two agencies supported by United Way. My studio guests are Libby Safrit, executive director at Teen Health Connection, and Ellis Fields, executive director of the Mental Health Association of Central Carolinas. Welcome, ladies.
Thank you.
Thanks for being here today.
Absolutely.
I want to start with big picture and learn a little bit more about both of your agencies. Libby, could you start us off?
Absolutely. So Teen Health Connection is an adolescent healthcare practice. So we take care of teenagers, right? 11 to 22. Because we're looking at teenagers, it has to be comprehensive care.
Right.
It's very time consuming to take care of teenagers. 3 leading causes of death for an adolescent: accidents, homicide, suicide. All 3 of these things are preventable.
Right.
So we need to take the time to really talk and connect to teenagers. And because we know that health, true health, is comprehensive, it's not just physical, it's also mental health. So we have physical health care services as well as mental health care services. We also have a Center for Disordered Eating, and we do a lot of community outreach for prevention.
Okay, great. So I learned a couple of things just now that I did not know about your agency.
It's the beginning.
Yes, absolutely. Ellis, you want to tell us more about
Sure.
mental health?
We've been in this community since 1933. We currently serve Mecklenburg and Cabarrus County. We are not a direct service provider such as Libby, but we do focus on promoting mental wellness within the community through advocacy, prevention, and education. So a lot of community outreach in terms of different trainings and curriculum that we can deliver. We also have some semi-support programs such as CompHere, which is matching community volunteers with an adult who is living with what I would describe as chronic mental illness, lifelong mental health issue they are managing. We have a parent voice program that works specifically to support families who are raising youth with emotional, mental health, and behavioral health challenges. And when we talk about advocacy, we're looking more at systems advocacy and perhaps self-advocacy rather than case, where we don't really walk with a customer through the process. If you will. So that's a lot about what we're doing.
And we're going to see a video in a minute, but I have a quick question. So you mentioned how you help parents and do all of that. The audience that you're serving, is it any parent in the region that can use your resources?
Absolutely. Any parent can use our resources simply by calling the office and getting connected with one of our parent voice staff. What's unique about that program is that all of the staff with that program are family members themselves. They've
lived it.
They are or have lived it. Mm-hmm. So they're very expert based on their own knowledge of the systems.
Excellent, excellent. Well, before we dig deeper into some of the work that you two do, I want to first show you guys a PSA from the Mental Health Association. Let's take a look.
In the past, I've felt sometimes embarrassed.
Fear, like I couldn't do anything.
It was very overwhelming.
I went into a deep state of depression.
I have bipolar disorder.
I have depression.
I suffer from anxiety. It was really hard to talk about.
In my family, we never talked about those things.
Something I've been afraid to talk about for a long time.
In the same way that if you have a physical issue, you break an arm or you sprain an ankle, you go get help.
Stigma.
Stigma.
Stigma. Stigma is the #1 reason that people do not get the help that they need to begin their journey towards recovery.
It's okay to need help with mental health issues.
It's helped my life tremendously, like, it really has.
Just surround yourself with a supporting cast.
Mental health matters. It's time to talk.
Take the pledge today to break stigma, one conversation at a time.
I love you, Graham.
Well, that's the third time I've seen that video, and every time that last scene just really gets to me. It's an excellent video.
Thank you.
Can you tell us a little bit more about how it came about?
It's one of those issues where all the stars aligned. For years, we had been wanting to figure out how we could tackle stigma. What could we do? And each year when we have a new board chair come on, we ask them what their goal is. This particular year, we had a board chair that was in marketing, and she said, I'd like to help do something to raise the visibility of the organization.
Right.
Which is a great goal, but I said, let's tie it to some type of messaging too, so that we're actually promoting our mission as well. And the anti-stigma campaign came to mind. We had a board member who was a videographer, donated her time to do all of the shooting and pulled in her friends and family. We had a board member who's a musician that wrote the music, composed the music for us, so we had no issues around copyright or anything like that. And then everyone in that video is associated with our organization. They're real people living real lives with real challenges. They're either board members or ambassadors or program participants.
Wow, that is amazing, because to have something like that done professionally, and it is professionally done, is quite expensive. You're very fortunate, very fortunate, and very well done. Where all are these going to air?
We're trying to get them out as much as we can in public media, using public service announcement time. We've got them on social media.
Absolutely,
we're out there on YouTube. We just last week had a wonderful event uptown that kind of spun off the flash mob concept, and we had a flash video event where we used all the large jumbotrons uptown and aired them. So the possibilities are endless, and we're still working to roll it out and get it into as many places as we can.
Excellent, excellent. Libby, I want to switch over. You have a program called, and I want to make sure I say, the Big Picture Project. Can you tell me?
The Big Picture, yes.
Yeah. Can you tell me a little bit more about it?
Oh, absolutely. So the Big Picture, another multimedia way of messaging, right, and really connecting with our community. The Big Picture is a play that's written by students at Northwest School of the Arts, the playwriting class, which I believe is the only playwriting class in all of CMS. So they write the play is written by teenagers, and they base the play on data that's collected through the Youth Risk Behavior Survey, which is done by the Centers for Disease Control. It's nationally normed data.
Right.
And it talks about the risk behaviors that our local kids are reporting. So it does middle and high school.
Okay.
So for example, in the YRBS data, it's found that 1 out of 8 local high school students has tried to kill themselves in the last year.
Right.
Right?
Yeah.
This is significant.
Yeah.
Absolutely significant. Also in there, we learned that 28% of high school students have smoked marijuana in the last month, while only 14%, which 14% is still way too high from my perspective, only 14% have smoked cigarettes. We have more kids smoking marijuana than are smoking cigarettes. So we've got our children, our kids out here engaging in these really high-risk behaviors. How do we get to them? How do we talk to them? You know, they're all texting, they're all YouTubing it. How do we really get a message across? So we went to the high school students at Northwest. They wrote the play. Then they actually performed the play, which is phenomenal. It's run every spring. This year in the end of March, beginning of April, will be at the McGlowan Theater. So we'll touch over 3,000 people, a play performance every day. And we bus over, if you can imagine this, 9th grade health students. So we also work with CMS with their health and PE curriculum department.
Oh, wow.
And come up with pre and post testing. And then the entire play is created into one video, of course, but then vignettes. So throughout the rest of the school year, not only our local CMS folks, but people across the country can actually access these videos, these montages that they can use and talk about these tough issues. Tough issues.
Now, do the kids do a twist on the written piece each year, or are they rewriting it?
Every year it's changed a little bit. Of course, the data is updated.
Sure, so that's going to
but every class wants to do it a little bit different and put their spin on it. And what's nice is that they have to keep it relevant, right? And so what was cool or funky last year is different. Whatever's trendy
whatever it is this year.
Right, so it's different music. They do just a lot of parodies and things that they think are funny, but I don't think they're so funny. Right. You know,
but the kids get
it. But the kids, they're
well, and they're speaking to their peers, which is what we were just, again, getting out of that stigma, right? And speaking to their peers. You know, obviously your two organizations have common ground. We saw teenagers in your video. You've got this phenomenal, program that you guys are doing.
Just one piece,
exactly. Can you talk to me a little bit more, about how you guys work together and also some examples of working with the teenagers?
we were talking about that earlier, and there's lots of ways we could work even better together, but system of care really came to my mind. And if you're not familiar with systems of care, it's really a movement in communities to look at youth and families, and particularly those youth with mental health, behavioral health challenges, and how do you work with that family, looking at their needs, their desires, their goals, in a supportive manner. How do you bring everyone to the table that needs to be around that family to support them?
Right.
And Libby and I have kind of been there from the beginning of that, sitting at the table with groups in Charlotte.
Right. You know, and it's so often we have folks that it's fragmented.
Right.
You know, you go here for this, and then you go there for that, and then nobody's talking, and it's more of a burden or a hardship on the family.
Absolutely, yeah.
Than what needs to be. And so it's a system, not plural, but a system of care, so that we're all one system wrapping our arms around the families in our community. And they can be, certainly they can have a mental health issue, but perhaps it's not a mental health issue. Maybe it's an academic and a juvenile justice issue.
Right.
It could be a health issue. It could be cancer in that family. It could be a dying parent.
Right.
Anything that could be impacting that family's, optimal functioning.
Right, right.
So
yeah.
we come together, wrap our arms around, and I just have to say that I love what I love about the Mental Health Association, MHA,
Yes,
right?
MHA,
MHA often is that because they're advocating from a system perspective,
right,
they're able to look at things differently than the providers necessarily.
Yeah, good point. Yeah,
right?
that's a good point.
Because they're looking for all people.
Yeah, that's a good point. Yeah.
Which and flip that over to the United Way.
Right.
What I love about the United Way is it serves every person in our community.
Right.
It's not just for those people who live in that zip code or those people who make
right.
this much money. It's for everybody.
Well, and that was one of the reasons, going back to why I asked earlier, who benefits from this parenting? Because oftentimes, our agencies are serving an underserved population, as they absolutely should. But what I love about United Way is that they're serving agencies that support all of us. And I can literally, on my hand, name 5 agencies that I have been touched by, in my life. And so, there's that piece of it that I think is so important that I don't think a lot of times people think of. When they think of United Way, they think of it's just one segment of our population, but
it is not.
It is not. And, when we're talking about, your system of care, as you said, and obviously it's, it's United Way fundraising season, and we've got lots of agencies. Can you two talk a little bit about, and this comes up at IBM all the time. Well, why should I give to United Way versus my, individual agencies? And this is coming more from, I would say, individuals who really don't have a specific agency, but they're just curious why United Way. Could y'all talk a little bit about why that is important?
We just had that conversation.
Yeah,
so go, Libby.
We did just have it. So I've been at Teen Health Connection for 15 years.
Okay.
And we've been a United Way agency for 15 years.
Right.
And every year, when it comes time for the campaign, I would give my money to the United Way, but I would designate that money to Teen Health Connection, because I love Teen Health Connection, and I want the folks at the United Way to know how important Teen Health Connection is to the community. Well, 4 years ago, I became the executive director, and I got this whole different perspective and understanding the importance of the general fund.
Right.
Right. So to give the money to the United Way, not specific to a particular agency. When we give money to the United Way, we're really trusting the United Way and the community volunteers.
The hundreds of volunteers.
The councils that make those funding decisions, it's amazing what the back end process of that. But we're trusting them to make good decisions.
Right.
They're going to hold these agencies accountable for outcomes, for being fiscally responsible with all of their spending. As opposed to if I write my check to this charity, I don't really know, I certainly don't have the time, nor am I going to be a major donor, right? But if I give it to the United Way, first of all, I know that there's the oversight, and then second of all, if I give it to the general fund, then I know for a fact that that's going to be distributed in a way that makes sense to these individual agencies, as opposed to designating it to one agency, which is what I did for many years. And what I found was, and this is the part that I was like really shocked by, and so I never, ever, ever give to Teen Health Connection designated anymore. And I say whenever
And you're the executive director, so boy, that says a whole lot.
And when I speak to a group, and I always say, if you like what I said today, I'm going to ask you, please give this money to the general fund. Because as the executive director, and as Ellis can tell you now, when we get our allocation from the United Way, some of it's designated, some of it's allocated, okay? The allocated part is guaranteed. The designated part's not guaranteed.
Could go away,
And I get this last year our designated amount went up, and I was so disappointed, okay? Because I can't count on that. I can count on the allocated. That's what we can budget, and that's what we have to be concerned with from the executive director perspective. How do I continue to fund and sustain our wonderful programs? So big support.
Well, and the other thing is you guys are both, you know, extremely responsible, fiscally responsible agencies, and so you know that the bells, you know, the few things you have to step through a few hoops and work.
It was not a few hoops.
I know.
It's a big process.
I know. It's a big process.
But it's more than worth the process.
It absolutely is, because you know then that you know that you don't have to worry that there are agencies getting money that aren't working as hard or providing as much information in way of services, right?
And I think it's really important for anybody that's listening that heard Libby say that designated money is not guaranteed to understand why that is.
Yeah,
and it may be that you would make a designated gift to Teen Health or to the Mental Health Association. Maybe 5 other people give designated gifts to our organizations or other organizations, but in this environment, this economic environment, when people have lost jobs, sometimes they've had to pull back and not fulfill their pledge.
Right.
And so then those dollars,
it's a reality.
Dollars actually fluctuate.
Right.
So when we say that it doesn't necessarily come to us as guaranteed, I don't want people to think,
oh yeah, it's not the United Way that's not giving it to us. If people are still giving to the United Way, certainly. But if you, you know, if you were working for, let's say Wells Fargo, right? If you're working at Wells and you just switched and went to work at Bank of America, or vice versa, both banks are terrific, right? But your pledge wouldn't follow you.
Right.
Okay, so that means that now whoever you designated it to wouldn't get it.
Right.
It's not the United Way's responsibility.
Well, sure,
right?
yeah.
But if it's allocated, then we're guaranteed that. So please give to the United Way, and please give to the general fund.
Excellent.
And trust, and really trust the United Way.
Wow, that, I mean, I have to say, I've not heard anyone say that better. That is excellent.
Thank you.
Excellent. So,
that's lived experience.
Yeah, exactly. 15 years of lived experience.
Yes,
yeah, exactly. So, okay, we've got a lot more to talk about, but we also have another video that personalizes this issue even more. So let's watch that right now.
A little over a year and a half ago, we got the news that my brother took his own life. It was really hard to talk about. There were a lot of feelings of sadness and confusion. At first, I was nervous, a little embarrassed even, apprehensive about sharing my family's story, and I didn't talk to a whole lot of people outside of our family about it, partially because I didn't know what to say, and partially because I assumed a lot of people wouldn't want to hear about it. But I've surprisingly found a lot of people who could relate, a lot of people that I may deal with in my daily life that had also struggled with this, and I had no idea. And it's important that people realize that there's help everywhere, and there's no shame in talking about it or reaching out, because you're not alone. So I think it's important that people know that there's treatment, and it's fairly easy to find if you are looking for it, and you're surely not the only one who needs the help.
Take the pledge today to break stigma, one conversation at a time.
Mental health matters. It's time to talk.
And we're back in the studio. That video was really powerful. Ellis, can you tell us a little bit more about the story and how it came about?
Absolutely. Well, Lindsay is one of our MHA ambassadors, and these are people with lived experience that come and are willing to share their stories. Lindsay came to us shortly after the death of her brother and just said, I've got all of this energy and I need to use it in a positive way, and I want to get engaged and involved with an organization that's addressing suicide.
Right.
So she really wanted to figure out a way to become involved. Had several ideas, but when this opportunity came along, she was one of the first to agree to appear on this video. And if you'll recall the video we opened with, there are 8 individuals.
Was she in that video also?
She is in that video also. So the campaign involves the 60-second opening video that we saw, and each month we're going to release these individual videos, such as Lindsay's that was released this month in October. So each month you'll see one of those 8 people tell a little bit more about their story.
Well, and she's obviously a young lady, a beautiful young lady, by the way, and very articulate, and I think that's really brave of her to do that. If she's watching, I commend you, Lindsay, because that is, you know, at your young age to, you know, have the willingness to do that, because she knows, I'm sure she's did it. One reason is because she's going to hopefully make a difference.
Absolutely. And this is, I guess, where some numbers might come in handy.
Yeah,
because, you know, in general, we know that 1 in 4 individuals are likely to experience a diagnosable mental health condition in a single year. sadly, 2/3 of those will never seek help. One of the main reasons is because of stigma and shame. And so this is kind of the impetus of this video. The sad thing about suicide is that it has become actually the 10th leading cause of death in the United States.
Oh my gosh.
And I want to say it's the 10th leading preventable cause of death because, as Libby mentioned earlier, it can be preventable.
Right.
We may not save everyone, but if we are aware, we know the signs and symptoms, and we know what to look for and how to move somebody to the proper resource, chances are we can save their lives. Major depression is the diagnosis most commonly associated with suicide, especially, again, when untreated. I'm glancing at my sheet here because it's just some really interesting numbers. In the United States, every 14 minutes, there's a completed suicide. I think we experience about 37,000 across the country each year. 1,200 of those or more are right here in North Carolina, and probably over 125 in Mecklenburg and Cabarrus County combined annually. So again, it's just the stigma. We've got to get people into services. We've got to get them the help they need. We've talked a little bit about substance abuse, and so that combination of having a mental health
It's part of it. I mean, it's typical. I mean, I shouldn't say. I know this personally with family.
Yes, that if you have already some major depression going on and you combine that with any form of substance abuse, which sometimes people see as a way to self-medicate, that then your risk factors go way up. So we've seen since 2008 the numbers for suicide continually increase, continually rise. Libby talked about the Youth Risk Behavior Survey.
Well, 1 in 8, is that what you said? 1 in 8
of attempted suicide.
Yes.
Attempted.
And we are.
And I would assume the numbers who even think about it are much, much higher.
Sure. Yes. And we are tracking higher than the national average. So North Carolina's tracking, or Mecklenburg County specifically is tracking higher.
Do they have any idea why?
I don't know that there have been any real true studies. We know there are a lot of issues going on. Some of these are unrecognized emotional behavioral health challenges.
Pressures are higher for some reason, and I don't know.
Think about the economy. Think about bullying.
The family
media.
dynamics.
There's just so much that everybody has to contend with.
I just was at the table yesterday with some youth from the Davidson community, and they were talking about the issues around cyberbullying and how big of an issue that is for students in middle and high school.
Well, the bottom line is our kids live in such a different world, certainly than we did, but even than kids did 10 years ago.
Right, absolutely.
You know, on this topic, did it show up as a significant issue on your student survey, Libby?
Bullying?
Yeah.
Absolutely. Right, absolutely. 16% of the high school students say that they've been electronically bullied. I think it was almost half of the kids in school reported.
Well, it's easier to do it on a device because teachers aren't seeing it.
There's the
Parents
anonymity.
aren't seeing it. Yeah,
right. It's not
an
the
anonymity.
same.
Yeah,
you know, it's not the same. But it's there.
Yeah.
You know, it was terrible. But just yesterday, we had WBTV was over at Teen Health Connection talking about fat shaming because there was a campaign that was going on to shame people about their weight, and it was just unbelievable, horrific things that somehow it's okay that we say.
I think I would say just physical shaming. You're too short, you're too tall. You know, and you know how awkward it is when you're in, when you're in
growth spurts, adolescence, and acne, and and
physical
things are forming, and boys' voices are cracking. And,
exactly.
They're becoming adults, and it's a wonderful time of life.
But
it doesn't always feel like that.
It doesn't always feel like that, right?
It doesn't feel that way. Yeah. One last thing. Can you talk a little bit, because we talked about some of the audience you serve. Tell us about who is the audience that you are serving. I know you're serving teens, but how do those teens come to you?
So it's 11 to 22-year-olds, and it's interesting that our name, Teen Health Connection, we were actually named by our first teen advisory board, and 11-year-olds aren't teenagers, and neither are 20-year-olds. But that's the name that they gave us to be really, the connection for adolescent health.
Right.
So 11 to 22, and some people would debate, and rightfully so, that 22 you're still not grown. But
I was going to say I would put it to 24, 25.
Right. American Academy of Pediatrics would agree with you.
Yeah, exactly.
But we're 11 to 22, and we really see kids. Charlotte Mecklenburg primarily,
sure.
But actually across North Carolina, we've got folks that travel from Asheville, from South Carolina, for our Center for Disordered Eating. We're the only facility that has that comprehensive care where we have a dietitian, a medical doctor, and mental health all there together, coordinated in one location, and we serve males. How about 19% of the patients in our Center for Disordered Eating are male?
again,
Not
a
what folks would-
statistic that I never would expect
Not
to
what
be
folks,
so high.
not what I would have thought either. And as a psychologist, I should have been a little more open about that, but I wasn't. So I was surprised by that. When it comes to the care that we provide, you know, think first and foremost, we're a primary care office.
Right.
Okay. And I have to say, you know, a shout out to Carolina's healthcare system. We have had an exclusive community health partnership with them. It's been over 16 years. And so we have a very strong affiliation with Levine Children's Hospital. So we are very closely connected. And really, you know, where would you take your child if they needed their annual physical? People come to us for that. It's primary care. First, it's not all troubled youth. It's not all people with problems.
So can anyone come to you? I mean, like
anybody.
Wow. Okay,
Anybody
so
can
again,
come to us. Right?
what I heard, which I think is so interesting, both of you said any. It wasn't a you have to make this income, you have to do this.
Absolutely.
And I hope that our viewing audience is really taking that away.
Right. Well, and it's an important thing. And you know, when we talk, and I will say this, you know, we talk about underserved and high risk.
Right.
From my perspective, every adolescent, okay, is at risk.
Absolutely.
Right, because just what they have to contend with.
Right.
And so the thing that really makes Teen Health Connection different, and this is gratefully to the United Way that we're able to have this difference. When a young person would come to Teen Health Connection for their annual physical, let's say it's at 1 o'clock.
Right.
The next appointment on that doctor's schedule, and you're not going to believe this, is at 1:45.
That much time.
That much time. National average several years ago was 7.2 minutes that a physician was able to spend with a patient for a full physical. We're able to dedicate that kind of time and resources because we're a United Way agency, because we're able to leverage our relationship with Carolina's healthcare system. And, you know, we know that we've got to prevent all of these other high-risk behaviors. And you can't walk into a room and talk to a teenager about the things you need to talk to them about and be done in 7.2 minutes.
Right, right. Well, we are almost out of time, but I do want you to get one last word in, Ellis. What can people do to help with the stigma, to help prevent mental illness? What should people be doing?
The whole purpose of our campaign is to get people talking. Number one, everybody needs to start talking about mental health. Remove that stigma and let's not be afraid. But that starts with education. So get some education. Call the Mental Health Association. We can deliver QPR, which is a suicide prevention training. Question, persuade, and refer is what the letters stand for. That can be taken to any audience of any background, any age.
Excellent.
We also have mental health first aid, which is part of the President's plan to reduce community violence, part of his national dialogue for mental health. Lots of ways to learn more, then talk, but also come to Mental Health Association every month now is hosting a coffee and conversation.
Oh, neat.
So it's small groups just coming together. It's like sitting at the kitchen table and really just talking about common myths, common issues, whatever the topic might be. So really just getting out there and talking. And what's so great about what Libby's doing is this integrated care. For so long in our healthcare world, we have, you know, kind of cut our heads off and focused either on the body or on our brain. And it cannot be that way. It's all integrated. We just need to not be afraid to learn, to study, to talk when it feels right.
And be open about it.
Be open,
Yeah,
absolutely.
Well, you're right. We probably could have spent 3 hours today talking about all of this. But if you want more information about either one of their organizations, I do encourage you to go to their websites because there's a lot more to learn. If you're a parent sitting there going, I have resources I never knew I had. I mean, I literally got goosebumps thinking about that because I think so often, you know, people sit there and say, I don't know where to go to get help. Well, you know, if you are in need, if you're having depression, if you're worried about your children, you've got two excellent organizations to go see. I want to thank you both for being my guest today and for the work you do in this community. It's so vital. And you know, I'm proud to be a United Way donor. I'm proud to know my funds are going to help people in need. But we are out of time. I want to thank you both for being here. If you are having issues and you need some help, you can dial 211. Dialing 211, you can dial 24 hours a day, and you can get the help that you need. I'm Ann McNeil, and thank you so much for watching the show today.